the topic that I will speak is mainly about randomization techniques, and although I will speak briefly on sample selection and recruitment. Okay, so again, please feel free to interrupt and to ask your doubts, comments, etc. So the first topic will be about selection and recruitment, and I will go directly to the sample bias. During the morning, we mentioned different type of bias, investigator-related, etc. Here, it's only sampling bias, and sometimes images speak a lot. So we have here the whole population, and when we are doing our study, for instance, this study group selected or invited and recruited these participants. Do you think they represent the population? Why? Too much green, okay? Why might this happen? There are different possibilities that you should think about, but one important thing, this is not the same of narrow criteria for selecting your sample. That is a very different thing, and I will try to show you with some examples, and this is the first. So you have a team that aims to assess the effectiveness of a new exercise program in reducing stress levels among adults. And what this team did was paying an advertisement in these magazines. So they want people to do exercise and reduce stress levels. Do you think there's
a big bias?
A big bias. Why?
Because probably only people with an interest in fitness or exercise or whatever will be reading this, so only them will be recruited.
And the problem is then to generalize to the population. So here it comes the first question. What kind of selection bias is this? Or, not, that's the next question, sorry. The first question is, by advertising in these magazines, the study is likely to underestimate the effectiveness of the exercise, overestimate. It has no effect on the effectiveness if the groups are well balanced, the intervention and the comparative group, or has no effect. So there's already people replying, but you can have tricks here. So, or there's no effect if the sample is big enough. So be confident and raise your card high. Higher. So I see some greens, blues. It's the only options. So who wins? More greens or more blues? So it seems a tie. Maybe greens. And the correct response here is overestimating the effect, as it was mentioned in the previously by David. And the next question is, which kind of selection bias is this? Selection bias, you have different types of selection bias, and I'm only speaking about this. You have, it seems a mistake, sampling bias instead of the blue, investigator bias, volunteer bias, or confirmation bias. Which one do you think it is? Blue. There's too much confidence in the blue. There's some doubts with the red, volunteer bias. And I only see, so majority, full majority blue, and one doubt, red too? Yeah. So, and it's correct, it's volunteer bias. Although it seems, and I started by the selection bias, this is volunteer, because people who read that magazine will be more prone to volunteer to participate in this trial, okay? And if you want to know more about the difference, you have here the different types of selection bias. You will have the reference here, and you have the sampling bias, attrition, and volunteer bias. So people with specific characteristics, so more prone to do exercise, are more likely to participate than others that don't read those advertisements. It's also called the self-selection bias. Here an important notice. In Portugal, I will not say that in all countries, but for instance, compared to United States, in Portugal, when you do a clinical trial on a pharmaceutical, on a drug, you can't do public advertisements, okay? You can only recruit through hospitals or health centers. But for non-pharmacological trials, you can advertise on networks, etc. Okay, that's important. And I've checked with Cristiano, and he confirmed that that's the rule. Okay.
But when you put your experience all over the social media and etc., you have always the volunteer bias, right?
Yes. Yes. So you should use different and complementary ways to recruit. Here I was not saying that you should do the recruitment in the Facebook, because there are many people don't use social media and others. So you should use different ways to avoid that kind of bias.
But for example, if you are targeting a specific kind of people who have some disease, and you put your project in groups of social media, and you contact also associations with these patients. You have different targeting different contexts where you can have your populations, but it's volunteer bias also, because in these associations you have people interested or not in your project.
Yeah.
And even in so how to manage
How to address that? So you are already improving by using different sources, and then but they might be different populations. So you should consider with your team, if you use the recruitment process, if you use, okay, did you reach us through social media or through patient organization? And you might use that variable to compare the characteristics and to see if there's an imbalance in the baseline or in the disease severity characteristics from the group who reach you from one way or in the other. And you can compare this, and you can also use that in the randomization techniques that I will speak about, although it's not common and I think it's not important enough. More important is that you diversify the ways you will, and it also relates with the PICO question and the importance of preparing this before. Yeah, but that's the kind of thinking that the teams should have when thinking how will we recruit and where. If it's only in a tertiary hospital, university hospital, or if you go into a more local one, because also the characteristics might be different, the severity of the disease, etc. Thank you for your question. Any other? Okay, so let's move to the next point, which is one of more often errors that I see, is that people more often, I'll not tell you because I will do the quiz. So it's basically differentiating between random versus non-random selection. So I invite the first, the third, the fifth, the seventh, and so on, patients who come into the external consultations of my hospital to participate in an exercise trial. Is it random? Yes, no? Yes, but if there is only one entrance in the building, or it depends because more information is needed. Is this a random selection process? Yellows, one green, one red, and people trying to decide. 2 greens? Yeah, 2 greens. Correct answer. Do you want to explain? Or no, so yes, the greens. No, it's not random. They have not the same chance to be selected. So let's go in the next step, the same concept, but another way. Let's see if it becomes random if I invite all the patients who come to the external consultations on a predetermined a specific day in the calendar and who were born on even years, so anos pares in Portuguese, before 1975 to participate in the exercise trial. Is this random? Yes, because the day was predetermined. Yes, because you select all and only even year born patients. No, because it should have been more than one day of selection. Or no, because there was no same probability for all individuals to participate. So yellows, any different option? Still some doubts? Yeah, but you are correct. That's yellow. There's still no a random selection. And how can we do a random selection for this type of study? Any guess?
We may invite all the patients independently on the year of born.
Yeah.
And we, for example, if we have only one entrance, we can tell the patients to enter through that entrance, all of them, independently on the year. Maybe
Yeah.
they could have the same
You are
chance.
probably getting there, and
Even more days, for example, during a
it's simple. It's simpler than that. You just need to know. Okay, you can determine. You can have all the list of patients from that consultation. But if it's too big or not easy, you can. Okay, you can ask the secretary. Okay, what's the list of participants that will have a consultation in the next week? And from that whole list, you random select the patients to invite. If you, because you have limited resources, and sometimes you can simply go into all. That's clear? Okay, so let's go into the more difficult part, and the one that I dedicated more time. So I will be at, okay, 10 minutes for that. Randomization techniques. So this I have learned in a course that changed my life, and that's still open. It's very expensive, around 3,000 euros. But if your boss can pay you that, it will change your life. It's from the Harvard Teach School. And basically the slides were adjusted and simplified for you. So, but it deals with treatment allocation. So treatment allocation schemes should eliminate the investigator bias, produce comparable treatment groups in relation to known and unknown risk factors, which are the most difficult, and ensure statistical tests have valid significance levels. And the only way to address all of this is randomization, okay? So there are other ways of bias, like David mentioned, but randomization will deal with these three. So you have the simple randomization, like the name says, it's the simpler one, or unrestricted, and it assigns each patient to treatment randomly, independently of all others or of the previous patients, independently if the patient was randomized, the previous was randomized to A or to B, there's the same probability of the next one. So if you have A and B, the treatment of each subject is 50%. So this is similar to do what? To flip a coin, okay? But what should you never do? Flip a coin in front of the patient, okay? That does not give confidence. But you do not need at all to flip a coin, because there are already freely available online resources to do that, and that will facilitate your work. And also, you never should know in advance what the next randomization allocation will be. So that's what we need to avoid. And how can we? Yeah.
Just picking up on the example you gave before, when you have the list of the patients that you know are going to be in consultation next week, can you randomize earlier, even before the consultation?
That's why I will show examples on how to do it.
Okay.
Yeah. So, of course, this, like, imagine that is like flipping a coin, but in a different way. The problem of this is that you can have long runs. What are the long runs? So, you can have different times or different sequences in long sequences. So, the sequence of the same treatment many times, and also this will produce imbalance groups. So, you can have, by the end, treatment A with 60 patients and treatment B with 40 patients. And this happens a lot. Yeah?
So if we have an example, this example, if you want, for example, to have 30 patients in each group.
Yeah.
So when we reach 30 patients in the control group, for example, and you only have 20 in the treatment group, can you stop recruiting to control and all of the patients?
No, then you will know that the
which
next
group
patient
then?
will go into that group. And if it's a friend of yours and you think that the group for which he will be allocated is not good, you say, okay, better not to participate in this trial.
But for example, the first example.
And there are ways to correct that and to have the balance. And that's what I will mention next. So it's doing the next step, not the simple randomization technique. Okay? Of course, that as bigger your sample is, the less likely is that the groups become imbalanced. That's the statistics you have here. Okay? But there's better ways to do that. And that's the next ones that I will speak to you, which is randomization by blocks. And you use permuted blocks that preserves the benefit of randomization and avoids that the researcher guesses which will be the next. So instead of being flipping with the same probability of 50% in each randomization subject, here you do differently. You can have, for instance, block sizes of 4, and you know that first 4 can be, the first can be an A or can be a B. The third can be a B or an A, but the probability, it's not 25%. 25% here, but here it will be different. And after an A, B, and B, it will be for sure, the computer will random to A. You will not know, because this is in the information for the pharmacist, but it keeps that by the end of the individuals, the number will be the same, okay? So, and how can this be done? Through the randomization list. And here is an example. For instance, if you want to do a study comparing rehabilitation with a standard, and you want 20 patients, you can go to the random.org. I will show you how it is. But basically here you will have like this list. And by the end you have the same number. They are balanced. But sometimes, like I mentioned, here after B, A, B, there's a possibility to guess the next. So there's also a way to prevent this. If the researchers want to do like a scheme, and they can, I will show you, have envelopes. If you have envelopes, you can guess. There's ways to guess what's next, which should be avoided, and I will speak about it. But then you can also change the number of the blocks. Instead of being always a block of 4, then a block of 4, you can have 4, and then a 6, and then 8, etc. And it can be random. You never know if now it was a block of 4, if next it will be a 4 again, or a 6. So this makes impossible that you guess what the next patient, to which group it will be randomized. Okay? About the different sizes, I already spoke about this. So the blocks prevent that there is no long runs and you have the same number, and the randomized sized blocks prevent that you guess to which group the patient will be. But if you have more than 2 treatments, so not only the rehabilitation and the standard, but you have 3, you need to have blocks of different sizes. So no even, so no pares, but impares, okay? So you will have 3, 6, or 9, but this is also something that the systems can help you to do. And finally, I will only mention one slide because just for you know that there are other and more complex ways to do the randomization, but this is by strata. And it comes into the question of Diane? Luisa, Luisa, which I mentioned, okay, you can, if you think that people who come from social media is different from people from the patient association, you can use that to influence the randomization and to make sure that that characteristic will be similar in group A and group B, okay? But you should choose only a couple of variables to do that. Otherwise, it will be very complex. But one of the variables that is often considered here is the center. So if you have a trial being run in Oporto School, Coimbra School, and Lisbon School, doing an exercise trial, you should compare you should random the patients based on from where they come from, okay? But please pay attention to the categories, the number of categories that each variable can be divided, and also the number. The less, the better. But as mentioned, this is a much more complex way to randomize, and I will show you examples of the two previous forms, okay? And the examples will make it clear. I already mentioned you have the I'm not sure if the telephone is used. When I started in clinical trials, it was still used, but it was already changing to the web-based, which is more complex. If you can pay for have a better service, but there's also free. Or you can use the local envelopes, which is still very much used because it's practical and cheap, but you need to be some careful, you need to have some careful when doing it. And it's more useful in unicentric studies, okay? So when you do it by envelopes, you should first obtain the list, the randomization list. Then you should generate a number set of envelopes. So the envelopes, the opaque envelopes should be numbered, and someone puts the A or B in those envelopes. Then you can use strata, and if you use strata, you need to separate the set of envelopes. One set of envelopes for Coimbra, one set of envelopes for Lisbon, etc., to be equally distributed, okay? Be careful, and as mentioned, the envelopes should be very opaque, or the cards, when you introduce the card, you can do this and put the card, and it will be harder to see it. Or you can also have this list being only managed by the pharmacy, and so it will not reach the team who is dealing with the patient. And you can know a lot more in this Lancet paper about the care you can have with this. So I will skip this and go to the exercises. So the most known tool is this, randomization.com, but there are other tools, and I will show you the example I mentioned before. So 2 treatments, standard care and rehabilitation, using 2 blocks of 4, and then I will have 2 blocks of 6, okay, in a random order, and I want 20 patients. So I go into this is the screen you see when you go into the randomization.org. You write the name of the intervention, here 2 interventions, and the number of blocks. 2 blocks of 4, 2 blocks of 6. And then it generates this list, and you can see the blocks after it. So someone in your department will be able to see, not the researchers doing the technique, okay? And by the end you see 10 standard, 10 for the rehab, okay? Then if you add a third group, like a rehabilitation with something else, you turn the even numbers in, I don't know, impares, and you have also one group of 9, and then the list will be like this. Okay, so and you will have 9, 9, and 9. Okay, is that more clear now, or not so much? Yeah.
For example,
You should play with it, and yeah.
after you have your plan, do you print it, for example, or you should only do this at first when you do your sample size?
Yeah.
You know,
Andres, I think Ana Teresa and Ricky, they still use this system, but basically you should print it, but keep it in a secure place and from the researchers. So that's why I mentioned you can select the pharmacist or the secretariat person to do this. You should instruct, or of course if it's a trained person or if it's a professional. Of course, if you pay, you will have a better service. If you hire a CRA, it will be better. But basically, you print the list, and you put the cards, the envelopes. Now I'm a bit confused. So you print the list because
Yeah, if I'm going to do the intervention and she has the plan, she must tell me, okay, Bruno, this is for rehabilitation. Bruno, this is for control. Because if I am implementing the protocol, and we have 2 different protocols and one and usual care, I must know for which patient I apply the intervention tool, for example.
yeah,
So she must tell me, okay, this is for treatment 1, this is for treatment 2.
that's also the tricky and the difference between pharmacological and non-pharmacological, and when you can disclose or not disclose to which group the patient goes. So that's why this is also harder to do when we do non-pharmacological trials.
I was thinking in
Yeah.
non-pharmacological trials.
Yeah.
So it's better the envelope.
Yeah.
Because
Yeah.
the envelope,
The envelope, yeah, there's some tricks, but it's also manageable. But about that, maybe the colleagues from the Remedy can explain in a more pragmatical way how to do it, because they are much more experienced. I assume. Okay, so take-home messages. The sample criteria too narrow is not can make the samples too different from the real population, but you should take in consideration where you will recruit the patients. Randomization is the primary way to assign treatment allocation in the clinical trials. And if you have the capacity to use the block stratification, it will be better and to avoid bias. And of course, if you have statistical support, you can also use for this and to determine sample size. But of course, we know there are limited resources. That's why we try to build some capacity here. So thank you for your time, and try.